Imagine you're a community health worker on a vaccination drive in an urban slum. There's a child in front of you who has no past medical history, no formal government identification, no birth certificate, nothing unique to link them to their health records. The challenge facing you is, who is this child, which vaccinations have they had before, and what's the information I need to provide the best care possible? The thought we had is, well, what if you could take a person's fingerprint, something that's unique to them, can't get lost like paper medical records or vaccination cards, and make that the unique ID that ties them to their medical records, allowing a community health worker to swipe mother or child's fingerprints and then instantly link their fingerprint to their medical records over a mobile phone network. That way is the idea that we started with at SimPrints and the technology we're building since. So when we got started, we had no idea how hard this would be. We assumed that we'd simply go take a look on the market, find an existing biometric scanner, write some software to link it up to a mobile phone, and problem solved. What we discovered is that all of the hardware that was out there was built for the Western world. It was built for office settings. It wasn't ruggedized, it wasn't low cost, didn't have the battery life that could sustain for long periods of time in the field. And so we really stuck for a while and we didn't know what to do or how to get started. Then we made the decision, okay, well, if no one else has built this technology, could we build it? Could we bring together a team of GATE scholars and actually try and build from scratch custom hardware to solve this problem?
I was actually acquainted with Toby through the Gates Cambridge Trust. They put on lots of different events. And we were talking about this project. I knew about it. It was just such an elegant, simple idea that I thought could have a huge impact. So I found it very exciting. I suggested some competitions that he could apply to, and we decided to apply to them together. I asked my friend Alex at the time to join us in one of those competitions, and I knew Alex from the Gates Cambridge Scholars as well. She joined and she blew us away with how hard she was working and just kind of integrated herself as a core member.
When I first started, I started with the electronics, with the functionality, and then we were lucky enough to be in Cambridge and have the Makespace community here, which is a community workshop. And I went there and I found incredible people that were willing to help me at all these stages. We tried to see what type of components we need, what type of sensors we would need. There is a small camera that takes the image of a fingerprint. It converts it into a template, which is a long string of numbers that represent all the unique points on your finger. So this happens on the microcontroller, which is the microprocessor, the computer that sits on the device. And this string of numbers is afterwards sent wirelessly to a mobile phone. And then from a phone, it's sent to the server, and then it searches, and then when it found a similar template, another fingerprint taken for the same person, it provides a unique identifier. This unique identifier is then linked with the medical record of that person, and then the medical record will pop up on your phone. So that's kind of in a nutshell how the entire technology works.
So field testing this was really important from the get-go. I've been working in Bangladesh for the past 3 years now as part of my PhD research funded by the Gates Cambridge Scholarship. And so bringing the technology into the field, sharing it with community health workers, with doctors, with managers, asking them for feedback, seeing how it worked and if it worked was really critical. We were able to field test over 1,000 different fingerprints in Bangladesh last May, and that taught us both the potential of the technology and also some of the limitations we need to get right in the next iteration.
SimPrints will figure out how to make the product work better for the developing countries. The idea of sort of creating a sustainable, virtuous cycle where the profit goes back into a social mission is something that's unique to social business as an idea, and SimPrints is very much trying to epitomize that. So the conversations that happen within the Gates community more broadly end up being debates that happen within SimPrints about how do we create this in a way that really delivers on a social mission. It's definitely the wave of what's coming, trying to line up profit with social impact as well as environmental impact. And trying to do all of that, it just means that business has sort of more stakeholders than just their shareholders, which makes it more challenging, which is why you need, I think, really talented people to get involved in trying to think it through.